Hi, my name is Kathy Starink, and I'm a professor at Eastern Michigan University in the School of Nursing.
And my name's Linda Myler, and I'm also a professor in the School of Nursing.
We're going to talk a little bit about the nursing profession and just ask each other some questions about the profession to give you some more information. So Dr. Myler, what is your role as a healthcare professional?
So the role of a nurse is really vast. So nurses can be prepared in many ways at a bachelor's level, at a master's level, at a doctoral level. At the bachelor's level, they might be nurses in the hospital taking care of patients and families, and you might have experienced this in your life already. At a higher level, there's 4 pillars of the master's program, which could be a clinical nurse specialist who helps educate and teach, a nurse practitioner, and it could be a family nurse practitioner, it could be a gerontological nurse practitioner, and those type of roles are more of an advanced practice role. It could be a CRNA, which is a certified registered nurse anesthetist, which is a nurse that would have an advanced practice role in the hospital setting, possibly in an operating room. And then there could be a nurse midwife, and a nurse midwife would be somebody who would be involved in labor and delivery. And then you could get a doctorate as a nurse, nursing professional, and which would enable you to teach nursing students. So, and nursing can be in any setting. It could be in the hospital, it could be in the rural community, it could be in outpatient centers, and it could be in the emergency room. And now we're going to talk about maybe 3 things, Dr. Starink. What are 3 things that you do in your role?
So just talking in a broad sense, we're not talking about skills, but all nurses advocate. I think that's one of the most important things, to advocate for our patients. So we advocate in many different ways at the bedside, always looking to see what their best interest is, because we're the one that is there the most. We also collaborate with other professionals. So we are the ones that are kind of in charge of really coordinating all of the care. We're the ones that are there the most. So we are dealing with doctors and all other healthcare professionals like pharmacists, occupational therapists, physical therapists, speech pathology, all different professions, to really coordinate and have the best patient outcomes. We're also really trying to promote health. So it gives us an opportunity when they're in the hospital or in the office to come in and really promote health and prevent disease, and really looking at patient safety and how we can have the best patient outcomes again for our patient, really promoting health.
And so now that we've talked just a little bit about nursing and maybe some of the roles, what would be some advice that you would offer to a student that would be thinking about nursing?
So really, it is such a profession. It's such a gift to be at the bedside or, in the room when things are happening with our patients. And usually it's like a life-changing event. So we can always remember when we are entering into that and going into work, even though it's a routine day for us, that it could be a life-changing thing for our patients and their families. And to be able to be there and provide care and comfort is really a gift and an honor. And if we can remember that every day, it's just a great profession to go into and very rewarding. So,
And I think we've both been a nurse for over 30 years. And so we can honestly say that it is a rewarding and service-oriented profession, and we love nursing.
yeah,
Thank you.
thanks.